Ve kun sun pa. Kaya he totally different mo than I have to take again. So it will be a totally different one. Ilakwa like medical stream lama lunglut bangza kong yom du. Okay, nice. Come on. Okay. Tunin I topic dun ka a career in medicine chi kontela. Like medical stream bang chidana prepare di mo ay kele MBBS bang izil changa like kazerni akipat kon share uda why is the plus like how to after MBBS mo after MBBS ale a scope lian ma hiya why te kha tuni hon highlight ut kahi. Okay, first why choose medicine? Okay, so the first thing is doctors take out they're highly respected in our society, right? They're there to heal us mo, they're there to cure our diseases mo. Why so doctors okay na ka banga chile. There is we will surely get a solid salary, okay? And then job security. For example, like doctors take skills, knowledge jaka we will surely get a job, okay? Like for example, to ibuainas jaka ka kaibang paya an kahiya like kalomte to we are displaced ma paya ki ban ki displaced kaichu but ka skills yaka ka here Delhi ko no ka I will always have a job opportunity. Why? Because of my skill mo, because of my qualification. Kalomte bang paya ki pat an the same internship ka zo kitpe to after some months hijaboy na an mahiya amaw bang like Gauhati, ay kele mission hospital ko nga. Wherever we go, we always get a job. Why ka na teido kade hiya why so plus medical line ka we can go for teaching, we can go for research, we can go for management also. Mo why so atop na dinga to pen ka it's truly rewarding because we are there able to help people mo. Why we are able to improve people's life. Mo hay so adya ka eging to tia adya ka medical line lam ka banga ke experience why so ken kana lunglut ka bangza ka chile mi ka pan pi the mo hay so hay ka mission field ana hi kana ngai to mo like adya ka isep changa hi mi ging tulo ging low mi te tam pi to ki expose hiya why kan how you treat them, how you speak to them mo hay tingka it has an impact on their life mo hay saka spiritual impact le omdi amawa mental impact le omdi you are a healer mo why ka kun genut abana hey I'll skip this for a while. Most challenging part ka securing a place in medical school mo hey ka hey adya ka we have to clear the NEET UG mo. Hey, NEET UG exam ka i-clear ngai te hiya. NEET UG adya ka 11 to 12 izila we have to take physics, chemistry, bio mo. Physics, chemistry, bio ka we have to at least secure 50%. Why adya ka hey NEET UG exam adya ka ki apply te pandya hiya. Hey preparation ka bangchida na prepare din chile. Physics, chemistry, biology ka it will be all based on NCRT mo NCRT based di hiya why so adya ka kun genut ka like coaching la zo bang yom le coaching le la di but you should not solely depend on coaching, okay? Like you have to have your time for your self study why te ka cooperate mo ani to ka hang combine changa ka you will be able to do well mo why ka first like let's talk about biology too it's easy to understand, right? Why ka when you study biology try to master the NCRT textbook very well mo with the diagrams or with the names mo why ka and then try to make notes so that na revision changa it will become handy for you mo. And then about chemistry and physics ka atampia chemistry bang we have organic chemistry, we have inorganic chemistry mo hey te ka you sort out all the reaction mo why te ka gelding why so changa formula se not kading mo why te ka which are quite kedi. Plus physics ale you have so many formulas to learn why te le quite kedi why so you will solve question based on those mo based on those reactions based on those formulas mo why ka we have to go through previous year question very important mo why ka like 15 years back or 10 years back minimum mo and then hey te ka you can get books or you can get it from online sources like Need Prep, Memonet, chi khong mo hoi lo wa tu lai ta ka ki thang ma physics wala bang mo hai te om hi hoi lo wa online or offline ale tun kha coaching op the hi ya adia ka Delhi context again they are on offline we have Akash and then we have Alien, we have an academy le ommo has a physics wala bang hey te ka online na le op the hi they all differ depending on the package ma so why so can cause we be thum no kya kon hilu de hile like first always be clear about the basic mo NCRT textbook ka master somte te di mo here ki pachon ki dong di here not outside this so you have to master this when you master the basic you'll be able to solve the questions perfectly mo and then second most then akipat again sa revision ka we are so like human brain is like we tend to forget things mo tuni again bang tuni what you studied today you will forget day after tomorrow so revision is a must mo aisa ka like study plan boldi in a week if you're able to you should plan that you should complete this subject or chapter mo from biology or from chemistry or physics like at the end of the week you should do MCQ on your own mo na coaching la tebang like MCQ test kong kinesial thoma why ka it might be monthly but you should also do self assessment where you are weak mo ka weak na part banga chi ka naki assess nga hi why ka revision ka poi mo why MCQ ten solve na dia why so like alas na then again maabanga ka always solve tons of questions mo tampi solve di tampi na solve chang ka nang you will be oriented in such a way that you will come to know how they frame the questions mo so how to like eliminate those options mo why chang ka on ki thei siam de udin chin and then sometimes previous year questions on ki repeat le om tho hi MCQ le chi kha kon genun mo and then to ka need exam hi kizo changa ka ke hunlaya ka you can score 400 and you can get a good seat but now it is impossible mo hazo iboy na zya ka to ka igam manipura ka ki boyin chin banga chile MBBS seat ka infala ka jenims to rims all mo government na pailo asiza to private here jenims to rims ka we have around like in jenims we have around like to increase to 40 seat for ST then rims ka around 10 but now a kwama amy lamte ka we cannot offer it kwama ka like if you offer it you won't be able to go and study there so no one is willing to offer that mo the only option available in our state is Chuchanpur Medical College mo Chuchanpur Medical College there is around 27 seat but the problem here is phaya kipat naga temo adya ka AST again they all offer CMC and they studied in jenims ama ko chahi the elam te kha ki the lo ya kha unfair ma hiya he kha issue kha hiya why za ka iha pan ngai wa hi chi kha kon genuta bangza ka chile all India quota kha seat mu dikha hak sama ma you have to score like 500 plus while like you won't like Delhi bang ide ile bang chu it should be around 600 plus mo ai zaka iha pan ngai hi chi kha kon genuta then ya list of medical courses ya need UG noy kha ya te some like MBBS job lo walet tampi hoi omahi mo like Bachelor of Dental Surgery bang mo arts lam crafting lam lunglu te bang chu adya ka hai dental lama paile hoi ma hi chi kha kon genuta hoilo adang BAMS Ayurvedic lam bang hai bang chu I government into lai takin a promote ma hai lam male job opportunity ai kele hi di tampi option tampi hoilo veterinary bang ai kele physiotherapy lambang le mo option tampi hi MBBS lawa mo adang paramedical te kha BSc nursing bang adya ka nume pasali ne hi the mo pharmacology optometry chi le banga hai when you go to a doctor eye doctor optometrist and kind of vision contest jalu mo so wailo wale medical lab chi te bang very essential very poimo mo so radiography imaging technology te like for example MRI CT scan la te technician te omlo wa ki function lo wa hi wa kha kon genuta to abang hai for example MBBS bang muzolo bang hile we can offer BDS mo ale adya ka numei te bang le nursing bang le it's a very good option mo mo hai bang to state in kha they have common entrance test chidan do exam khat ki organize yele here why no kha you can opt for nursing or all these paramedical courses mo why kha state ale why lo ale state kwata ka Mizoram ai kile Guwahati khongale hi chi kha kon genun mo why lo then need UG seat lama extra point khat kun genu ta hi le Manipur state in kha kwata ki nei lo hi Meghalaya ai kele Mizoram or adang state northeast adia ka Meghalaya to Mizoram ten kha even Delhi ka Delhi University noya to ke kasep namun lady Hardinge khonga they have seat quota mo ma'am si khong hoi jaka kha Manipur ate kha like I said before we have to work really hard mo why he then second point the most challenging part then entrance exam clear why clear kids chang kha beilo mo iha pansem ngai banga chile we have to get through that 4.5 years course and 1 year compulsory internship mo internship it is a paid internship here then about a course 4.5 years you will study about 19 subjects mo first year lama you will study about anatomy physiology biochemistry anatomy you will study about the body cells organs tissues and then how our body organ system they function mo physiology you will study about the physiological part of how they functions together mo so biochemistry ite banga chemical reaction that is taking place inside our body mo community medicine like how community medicine we are exposed to the community mo we go for like vaccination program health talk kongki mo subject so next pathology chi changa body as tissue cells how they get banga nat na hon ki pat khyak dan kha ki study hi hello microbiology chi pena kha like virus bacteria fungi algae then how they cause disease in our human body ma hello forensic medicine using our medical knowledge in like finding out the cause of that ma the cause of injury khonga ma then pharmacology then damdoite how do they affect our body how do they function how can it be used for treatment how can it be used for diagnosing ma why so ENT chi changkha it is about the ear nose and throat mo head and neck lamma why so ophthalmology changa kha mit lamma something that is associated with the pathology of our eyes mo why so medicine surgical branches or OBG te kha final year lama kizila here OBG te ko like as we know numei lamma pediatrics ichi changa kha you will be treating with you will be dealing with the neonates you will be dealing with the kids mo while dermatology like with any pathologies of the skin ma why so changa radiology lama kha you will be interpreting disease via CT scan X-ray MRI ma while anesthesiology ichi changa kha they are very essential banga surgeon te to kha amao kha ton kom gi ge ma surgery cannot be proceeded without an anesthetist ma I kha something just a glimpse about the course here why kha throughout this 4.5 years it will be a lecture based practical classes letam pi omding why is a clinical posting le omding mo lecture based to like first year second year you have a lot on your plate mo there is so much of practical you have to write up so many practical hiya why so changa clinical posting akha it is your exposure with the patient mo this is the time when you get exposed like ebang isil tunga first year ka patient to ki deal lawe chu so like we thought that medical college kiluta like patient to interact pa di kong ana kisamo hu cha ana hilawin chen second year kong aka clinical rounds on kipepan why changa ha you will start to interact with patient and then you will feel like oh like really my dream is coming true ma why ma it's so theoretical that you are fed up of it ma why ka here why so it's about being a doctor ma I will be honest like doctors take it is a really a stressful job ma while banga the stress is like medical lamahi hierarchy aki maintain ma mo like to aka internship pen kha new pen te hi am internship is ochang in junior resident is ochang senior resident is ochang kha assistant professor associate khongki panahi why kha the pressures come from everywhere mo itung omte or sa pite bang hon cooperative law amaw bang ana lazy de mo ana bang sincere law de khong hi changa kha wailo na patient te bang some patient are very difficult to deal mo ai zakin kha wailo ale like banga working hours te bang le ave kha factors tom kha in on ki club changin kha a stressful thowa why zo chang it requires hard work mo why zo teamwork coordination team leader hi mo responsibility lag chi khong apoi mo ma why lo wale you can get depressed mo during medical school ale haksa kana sa thewa echo hilo ilom te khong le there are times like we feel very down mo there are times like banga why am I here chi kinga ito hun oma why saka can like what I want to say is that nalunglun mama le I want you to go mo nanule paten hon sol jaka naludi hile konde sakke mo ilunglud jaka iluding hile kizoding a hi chi kha kon genu ta so interesting mama mo patient te case khong iwamu chang kha like it becomes more and more interesting mo why kha haiting a hiya abana like some characters, right, that I think is very much important if you want to become a doctor mo. Tulahi doctor siyama maoma like degree sa OPP super specialty. But when they talk with the patient, like they just write the prescriptions and get it done mo. Like even if you are treated that way, na de KD chika like that is what I think about it. If you are a doctor mo. You have to have some character. Why that will make you a good doctor mo. Why ka first pena ka isyam na skill te ka ikimong ngam ngai hi mo isat khyak na dia why so changa empathetic mi imihin pi te ka cha thei syam di mo banga amau problem like not just physical patient ka banga they come because of their physical pain, but mostly everyone has a mental problem also mo ai saka in hopi dan ka an important law why so changa imihin pi te ka he pi dan isyam ding a hi why so personal taka like for example you should be when you talk with the patient you should so like interest amao banga lunglut taka hi ding a hi why so changa aneu alian aveka za dang siama hi ding why so itil hi te ka pilwang taka hi di thorough we have to be thorough mo icha ammo ka hi ding hi mailowa you are dealing with a life mo why zaka you have to be very thorough mo why so changa lunglut na ne gi ge di mo zilut na ne gi ge ding chika poimo ma kasa why abana MBBS degree beilo hi MBBS degree jo kha career option tam pi omahi mo why te kha tu ni han highlight ut kahiya ama sa pena kha you can pursue a PG specialization kai kha hon important ma hiya for example if you work under the government as a medical officer mo PG specialization na nei lekha nanga dia advantage tam pi omahi chi kha kon genu da why kha like you can specialize in any of the 19 subject dena kon gen pen mo any of the 19 branch. So and after this you will become a doctor of medicine and a master of surgery mo okay so changa lekha izil be ulai le super specialty omlai hi chika kon genu for example surgical branch bang to PG hi surgical branch bang labang hileng super specialty akha ke kha neurosurgeon khong lam pai theimo ai kele urologist lam khong pai theimo chidan dawa Saupi omahi chikakon genuda. A second option akha you can apply for the combined medical service examination that is conducted under UPSC mo haino akha you can be appointed as medical officer in Central Health Service or railways ay kele municipal corporation kong ay kele municipal council kong mo you can be appointed as that while wale army doctor bang ud bang iom lebang armed force medical service ten le short service commission wayaka recruit zeluhi medical officer chika kon genuta while wale like denan ka highlight 19 subject lawa adang alemo pursue te PG te for example PG like master in elite services hospital administration ay kele public health ay kele MBA in healthcare management lamale pai the hi chika kon genuta while research to tu lai bang adya ka mo pharmaceutical company te khang ai kele research institute ten kha MBBS graduate te khang opportunity tam pia piawa for example ICMR mo Indian Council for Medical Research te khong ai kele CCMP ten kha clinical trial idam doi te khong to inek te khong bang le they were all based on research mo ai za ka kha kaya le good option for a line of career after MBBS ahi chi kha kon genuta or you can become an academician mo you can pursue PhD khong le pursue te ahi to postgraduate khong izo changa PhD khong pursue te wai zo changa teaching profession lama le pai the ahi dena you have to nu gen ba banga academician hi lekha it is very highly respected and also a lucrative career option ahi chi kha kon genuta why so sagi na din na international organization ten kha like WHO UNICEF ten lekha MBBS graduate te kya ka or like they offer job like as a physician or as a medical advisor or as a public health officer or a surveillance medical officer din ka opportunity tampi o mahi ay international organization waya le chi hi contact lang uta wailo wa alas no depende na like lam lunglu te bang mo adya ka kha you can write up many papers research paper or you can be a part of the medical journalist team khongale mo and then you can be you can get employment at pharmaceutical companies or the publishing houses te khongale opportunity tampi o mahi chi kha kon genuta so like alas na dina banga kun genut ahile to it's highly essential mo to evaluate your interests your skills and your long term goal mo ele evaluate ka poi mo kasapet ma tuni how to te kamale tampi feel to am to mon genwa ele ko ya to adya ka heya 11 to 12 July te bang adya ka koi line lam ka lunglu ta chi kha the kya kha poimo ka sa he why so isep na ilunglu na pe na kha ku kal taka le sincere taka pan ilaka I follow di hi chi kha kon genuta ya he in ka zo dia questions handongun amuhya
career options lama para medical lam kong lenan kong sekha nursing lam ba ki tamma ma ma pulala Delhi lam itale ai kha no mai lam ki tamzo ai job opportunities ko om cha kha no mai abang kan opening sa position tam so ya pasala tom so ya chibang mo ai kele is it just a stereotypical notions that pasalin kila lo mo ai bang pin taka si nan gen theida
ken ka theida no bel like stereotype hi chi kha kon genu ta mo azak bel male nurse chi kha ei lam ma bang ki thang ma lo mo but if you go out in this metro city khongale om thoa hi mo why so there is no like selection criteria ka female to win apply di chi om lo hi why za ka kha BSc nursing le it's a good very good option for male mo chi kha kon genu kun dong